Hi there, I'm very excited to welcome you to another exciting edition of The Baby Doctor. We received all your feedback from the first episode and we are grateful that you could make time to join us. Babies bring so much joy to families, and once the news of pregnancy hits, everybody just can't wait to meet that baby full of good health and life. But what we sometimes fail to realize is that there are a lot of activities and decisions we take that affect the well-being of the child the mother is carrying. Today, that will be our focus on The Baby Doctor. Thanks for staying on The Baby Doctor with me, Bernice Abubedulansa. Today we are looking at in utero health care, what you need to do for baby once you conceive it. Dr. Paddy Ayate of Elimas Health has graciously agreed to be with us here again, and we are so thankful for his presence here because of all the wonderful nuggets he shared with us in our previous edition. You're welcome, Doc.
Thank you for
having me. Good to see you once again.
Good to see you too.
All right. Now, why is prenatal care so important? I have met women here in Ghana who say in the past, our mothers were, given stuff at home. They managed to give birth to us. What's all this fuss about going to the hospital every time, going to sit down and have some gel rub on, like all these things? Why is it so important?
A mother and her life, and the baby, and the life of the baby are very important. And the objective of prenatal care is to anticipate problems and prevent problems, so that she can have a safe delivery. In those days, yes, they were pregnant and they had babies, but they also had a lot of problems, and people lost their lives. A lot of people lost their lives. In fact, that was part of the reason why delivery was so hazardous, that when you have a baby, the old people are so excited that you survived. As they'll say, yes, because they know that there's a significant probability that you may lose your child. Now, if it was that normal, that people went and had their child babies and came back without events, nobody would be so excited about a successful delivery. With education, with knowledge, with research and understanding, we've come to know that if we see protein in your urine, it means that you are at risk of having a convulsion. And that convulsion can result in the death of you or your baby. We've noticed that if we see sugar in your urine, your baby can become oversized and make it impossible for you to deliver vaginally. And that baby may die unexpectedly in your womb. Those things are what make it possible or necessary for us to do antenatal care, because then we are looking for the things that will give you problems tomorrow. We've noticed that if the baby is born and grandmother uses some herbs to treat the cord, and there's something inside, what will be the results? You may have tetanus. So for that reason, we don't want to do that either. So these are the things that we need to address and try and ensure that how can we anticipate these problems? How can we manage them when they do occur, so that at the earlier stages of the disease, we don't allow it to progress into more advanced stages of the disease to result in a successful pregnancy. So essentially, that's what it's about. anticipate problems, look for problems, stop problems pretty early, preventing them from advancing, and ensure that we get a good outcome at the end.
And Doc, once we've established the importance of pre or in utero health care for the child and the mother, in this country, depending on where you are, there are certain medical services that you may receive or not. What are the basic things that every mother should look out for when they go for a prenatal care session? I.e., wherever you live in Ghana, whatever amenities are available, what is the basic that you should, the non-negotiables?
So like at each visit?
Yes.
At each visit. We would expect that they will check what we would call your vitals. In other words, they check your blood pressure to see whether it is okay or it is getting worse. They will check your urine to see if you have protein or glucose inside your urine. They would examine you, the mother, and ask certain questions to look for certain problems that may occur with you. And in anticipation of the fact that if we find those problems, then we can try and do some particular intervention about it. They would examine you, the mother, and looking for certain signs to make sure that you are doing well. They'll examine the baby. They will listen to the baby's heartbeat. They will assess the growth of the baby to see how much or how well the baby is growing. And then afterwards, they will give you treatment for any of these problems that occur. Then they will give you treatment in anticipation of certain problems, like treatment against tetanus, against malaria, against low HB, you understand? And then strong bones, things of that sort. They will give you the appropriate treatment for those. So those are the standard things that would occur at generally every antenatal visit. Of course, they'll check your blood level either by a blood sample or by examining you to see how to do. An ultrasound is not required for every visit. But some people tend to like, as they say, I want to see my baby. And then I want to hear the heartbeat.
Heartbeat,
yeah. You put on the Doppler, then you're happy. To feel that, oh, baby is doing well. But it is nice. I mean, it's not a bit unbelievable. This is something that as a man I've never experienced. The fact that something living is inside you, and it's growing, and it's breathing, and it's fully dependent on you. It's a wonderful feeling.
Doc, we'll go into the more advanced treatments that some people may access in different facilities across the country. But mother and father coming together to make baby, now baby has been made. But are there certain conditions that a father or a mother may have which will affect the growth of the baby, the normal formation of limbs and all that?
So there are genetic conditions that if the father has, he may transfer to the baby. Or if the mother has, he may transfer to the baby. Now, the problems with most of these conditions are that there are some conditions that if one parent has, the baby may have. And there are some conditions that if one parent has, the baby will not have it unless the other parent also has the same condition. So I'll use sickle cell as an example. And that's because it's pretty common. If the father is AS and the mother is AS, the father can produce a sperm which is carrying the S gene. If that meets an egg that is carrying the S gene, you would result in an SS child. Now, that would have a problem in utero most of the time, but after you deliver, that is when the challenges do occur. But sometimes the father has a condition and the mother's genes doesn't have the gene that counteracts that condition. And the end result is that the child then has some of these abnormalities. The issue we have to deal with sometimes is what do you do when these things happen? Because they are pretty challenging. Sometimes you can fix them after the baby is born. Other times, the couple have to decide as to whether they really it's something they wish to continue the pregnancy or not. There have been people that have been born that they themselves are carrying a particular gene defect.
Okay. And
when they get pregnant, the child automatically carries that gene defect. And there have been cases like that the child who had a problem that the father had or that the mother had. Those ones, they are genetics. You really can't do very much about it. All you can do is to plan for how you manage the child after the child is born. But it's life.
What about chronic diseases? Say, mom is hypertensive, or even dad, or diabetic, or has any other
For
condition?
a lot of these conditions, yes, if you're, that's what they call a family. When you go to the hospital, they ask you, does anybody in your family have the following conditions? Then they ask you a long list because they are inherited. So if your father is diabetic, it's entirely possible that you will inherit the defects that made your father diabetic. With diabetes, thank God, we can actually pick it before you become diabetic because there's a process that occurs. And there's certain tests that we can run that will tell us that you will be diabetic in 10 years or in 20 years. And there are interventions we can put in place today, available today, that I do it on a regular basis, that we can actually try and prevent you from becoming diabetic because we can correct the defect that is occurring in your body now. That will ensure that you're not diabetic. So if you are diabetic, if your father is diabetic, or your mother is diabetic, and you are not one of those people who became diabetic young, you really shouldn't be diabetic in your later years. Because there are things you can do today to ensure that you don't become diabetic.
Okay. And
action should be taken. However, these are things that we transmit to our babies.
Does it affect, sorry to interject, but does this affect the survival rate of a child?
Okay, in some conditions, yes. So there was this lady who was trying to get pregnant, but every time she got pregnant, the baby would die for 3 months. And we couldn't understand why. So we sent her for genetic studies. And they took her blood, they took her husband's blood, they studied the blood, and discovered that one of her genes was faulty. She had a mutation in one of her genes, and the result was, this is what was happening. Subsequently, she saw a doctor, an IVF was done for her, and they took all the embryos abroad. And they came back with a report that all the embryos had a defect. And so none of them were going to survive. Now, the miracle about that lady is that she got pregnant by herself one day, and that one stayed.
Interesting.
And she's had that child.
Wow.
We haven't done genetic studies of that child yet. I guess we should, to see whether it still has that defect, or she had an isolated mutation that negated that. You understand? Negative became a positive, and then that is why that baby survived. But it was a great miracle that she had that baby, because after all the things she had been through, we knew that there was a problem that was going to be very difficult to surmount.
Doc, are there certain categories of women with certain conditions that you would recommend treatment for before they attempt getting pregnant? Because, sometimes you meet people who are very strong-willed and they say that, oh, it's okay, I can still have my child. But are there certain conditions that you would advise get treatment first, or before you get pregnant?
There are quite a number of them. I have a patient right now that has a heart defect. And they say one of her valves is not working properly. And she wants to get pregnant. And she's come to see me that, hey, doctor, I want to get pregnant. And I said, I need permission from your cardiac doctor first. Until he says that you are good to go, I'm not going to try. Because pregnancy comes with a certain amount of load and stress. If that woman has that stress on her heart and her heart can't cope, she will die. It's not worth it. It's really not worth it. I and her husband, we agree that we'd rather have her alive. So the focus is, how can we get the heart condition fixed? They plan to do cardiac surgery for her. The hope is that once that surgery is done and her heart capacity improves, we can actually consider having a pregnancy. If you have uncontrolled hypertension, pregnancy puts hypertensive stress. It's even going to get worse. You may end up with a stroke or something even worse, you may die. There's really no point. If you've got uncontrolled diabetes, another problem, even getting pregnant is going to be difficult. And if you manage to succeed in getting pregnant, the risks of damage are so high and so extensive. Your diabetes might so likely going to get worse, and eventually you may even lose the baby. We would want you to control your diabetes first. If you've had a kidney transplant, we have a serious conversation to have, because the stress of pregnancy, once again, on the transplanted kidney, you would need a certain level of care. That if you are not in good health before you start, or if that level of care is not available for you, we will tell you don't try. Because we recognize the fact that anything that we think may put your life at risk, it's something that we would want to have controlled. to be in good control before you have it. If you've got excessive hypertension, you can lose the pregnancy. 6-7 months, baby will just die in the uterus. Diabetes too, the same thing. Even thyroid problem. But thyroid problems can cause high BPs. The high BPs can cause the baby to die. So even the conditions that we see on a normal day-to-day basis that people have and are walking about with, if yours is not under good control, it's not advisable to get pregnant. And that's part of the reason why we want you to be, even nutritionally, to be in good health. Because, for example, we give you folic acid. Right. The reason why we give you folic acid is because there's a condition called a neural tube defect, where the spine of the baby has gaps inside. And that gap sometimes causes the spine to, the membrane around the spine to bulge out and things of that sort. That problem is prevented by having adequate amounts of folic acid in your system. And that is why we tell women, before you want to get pregnant, take folic acid. Okay. And even if you are not planning to get pregnant, you just be taking the folic acid, because after all, half of our pregnancies are not planned anyway. It's normal.
You're right.
Yes. We are guilty, don't worry. So those are things that we can, so we want you to be, before you get pregnant, your sugar should be under control. Your blood pressure should be under control. You should ensure that you're taking the necessary vitamins, that your diet should be good. You should be taking the necessary vitamins to ensure that you are in good balance. When you get pregnant, your baby has got the stores in the bank to draw from when it is in its growing process.
What do you mean exactly when you say your diet should be good?
Okay. So, proteins, carbs, vegetables, fruits, we've all been told about a balanced diet. The unique part that we have to take note of, because in school they tell you, oh, you need to eat some of this and some of that and some of that, and don't eat, don't skip out your fruits and vegetables. And there's one thing about the Ghanaian diet. We don't really eat that many vegetables. I mean, contombre, okra stew, maybe tuwo zafi, then garden egg stew. Then after that, it kind of falls away. You don't have that much variety. Unlike, like Nigerians and the wide varieties they have in their vegetables. And a lot of people, I got a patient today, her husband said, I make salad for her, she doesn't eat. In my head, I was saying, hey, you are lucky your husband is making salad for you. You won't eat because she doesn't like salads, but she also doesn't recognize the importance of those kinds of things. But one of the biggest challenges we have with our diets, and this is a pet peeve of mine, is that we eat like farmers who are going to weed. Carbohydrate-dense meals, which provide us a lot of energy, intended for weeding, digging, pulling fishing nets and things of that sort. And all we pull is a pen and a paper. So we are eating the food that a farmer should eat, and we are doing the work of an office worker. So we are eating, we are eating carbohydrate-dense meals. The problem with carbohydrate-dense meals is that you have excess carbohydrates, and that means you have excess sugar. And the excess sugar is what is converted into fat, cholesterol, blah, 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 and all the problems that we have. If we have less carbohydrate-dense meals, or we reduce the amount of carbs we take, and increase the amount of vegetables and fruits that we consume, we would be in a better balance than we were, before. We are all guilty, don't worry. White bread and soda is something that we all like, but something that we all have to be a bit more careful about in our consumptions. Right. But if we adjust our diets a little bit and eat healthier, wider variety of vegetables, a wider variety of fruits, fruits are better consumed whole than juiced, because whole includes fiber, and that slows the glucose absorption, prevents glucose spikes, and there's a whole discussion we can have about glucose spikes and the effects that it has. But excessive glucose in our blood, obesity, diabetes, they've actually found links with hypertension and links with several other disease conditions, even cancer, just because we have high levels of sugar, glucose in our blood. So those adjustments in our diets would ensure that we are healthier, and we can also give us healthier babies.
Once we've brought up the issue of diets, there's a common thing that most pregnant women deal with, cravings. cravings. I mean, you hear some of the things women crave when they are pregnant, and you wonder what is happening. Why exactly are your taste buds working in such abnormal ways? Someone says, for example, I feel like eating ice cream and something spicy. I'm saying, but how can you feel like eating ice cream and something spicy? It just doesn't really make sense. But that's what her body is telling her.
So you sprinkle pepper on the ice cream.
To
It
give.
can kill you.
Yes, but Doc, the things we crave, let's take what we locally call shire, right? Calabash chalk.
Ayelo.
Ayelo, if you're in Accra, that's how it's called. And the impact of these things on the baby. Now, the focus is on what mom is taking and how it affects baby. A lady told me, and she confessed to me, she said, look, I felt like taking beer. So I just put it to my mouth and I rinsed it and I spat it out. All these things, how do they affect the child?
It depends on, you see, the craving is there. The craving doesn't affect the child. Indulging in the craving affects the child. So it's normal to have those cravings. And the best way to manage it is to find alternatives that will take you know, your mind off the thing that you are craving to eat. One of the things that works, for example, especially in the first 3 months when your mouth is funny and you want something to put inside, is just ginger. So ginger has been found to reduce nausea almost as much as the medicines we give you. I mean, we give you medication and we give you ginger, the result is almost the same. So what can you do? You can take ginger, peel it nicely, cube it, put it in the fridge, have a small bowl of sugar if you want, dip the ginger in sugar, chew it. If you keep that in your mouth, less saliva, your mouth tastes a little bit better, and spitting is less, and you would feel, you know, you're a little bit, you know, not as bad as you used to feel. So ginger helps with some people. The problem with ayelo and that kind of stuff, it's essentially dirt. It's dirt. Something from the ground that has been molded, and then we end up eating dirt because we want to have it gives a particular kind of sensation in your mouth that it makes you feel a little bit better. The challenge is that all the worm seeds, you know, a few days ago I discovered some fanticane in my house that had grown a bit moldy on the outside. So I decided to peel it off, and I discovered that when I peeled it off, there were worms inside. And I was wondering, how did the worm get there? And it's fanticane, so maybe the worms were on the leaves, or the eggs of the worms were on the leaves, and they've multiplied and things. But I was really wondering how the worm got inside there. So this is a leaf that was cleaned before they wrapped the thing. And can you imagine if you're actually having the dirt itself in your mouth? It's not cool. The objective is avoid such cravings. So let's find other things that we can eat. If your craving is to drink beer, there's non-alcoholic beer. You can find non-alcoholic beer, you drink it. Apart from the calorie count, it will not cause you to have the alcohol problems that we are worried about. That is why we avoid it. I would not recommend that you go and smoke if you have a craving for
Tobacco,
nicotine.
yeah.
We would rather you avoid that, you know, totally at all. But experiment among healthy alternatives, and you may find something that works for you. So a woman says, you choose ice. I say, chew your ice. It's not going to worry your baby. It's not going to worry you apart from the coldness. If it works for you, please go ahead. I'd rather you chew ice than have ayelo.
Right.
So you find an alternative that works for you. If you can chew the ginger all day long and it makes you feel okay, I'd rather you did that than you did, you know, some other thing that is less harmful. Or some cravings are not bad.
What if I crave a lot of sugary stuff?
We have to find ways to. So there are sweet things which are not necessarily, okay, they taste sweet, but they're not necessarily as sugary. So two things. I'll give you an example. There's a fruit called monk fruit. You can find the monk fruit sugar, which is not as bad as it's fruit sugar, but it's not as bad as the processed sugar that we have from sugarcane. But then in this small red fruit, I don't know what the name is.
The one that makes everything sweet.
Everything is sweet. There's some in my fridge. My father has a tree in his house. Okay. So actually we scattered the tree that day, we took all of it. And then he has some lemon tree as well. So we did the experiment and ate it, had the lemon, and the lemon tasted sweet. If you crave sugary things, hey, go and get that fruit and put it in your mouth. When you finish, eat any sensible food. It will take sweet and to satisfy that craving. The objective is to find alternatives which are healthy. but only you can figure out which one works for you.
But how does it affect the baby when a mother is, you know, taking or ingesting so much?
First of all, if you have, for example, excess sugary things, sugar level goes up, insulin level goes up, insulin affects your entire metabolism, progesterone level goes down, baby's ability to survive, especially in the first 3 months, becomes a problem. If it's in the first 3 months, you may lose your pregnancy from excessive high insulin levels, most of its effects on progesterone. If it continues later on, baby gains excessive weight, unexpected fetal death is a risk, hypertension of the mother itself as a result of the excessive sugar comes, diabetes itself is a risk. All those things are risks, especially even, because all these medical problems of the mother puts the baby at risk. If a mother has hypertension in pregnancy, what you call preeclampsia, the solution is delivery. If the preeclampsia is at 5 months, that baby will not survive delivery. If the preeclampsia is at 8.5 months, most likely the baby will survive. You are almost certain the baby will survive. But the solution is the same, it's delivery.
And here the mother is the priority.
And the mother is the priority. So if you have to deliver the baby, if the mother has to be delivered of the baby at 20 weeks, the baby will not survive because it's too young. The treatment is the same. A young baby, young pregnancy, old pregnancy. The question is, how will the baby survive? So the objective is, how can we get you as far as possible? And so how can we avoid the things that will put the baby at risk? We say don't drink alcohol, because you drink alcohol, you can give birth to a baby that is alcohol dependent as a baby.
So the person rinsing their mouth, I mean, they're only rinsing their mouth. They're not ingesting the alcohol.
You know when you put methylated spirits on your skin, you know it starts feeling cold,
Right.
because the fluid is evaporating, but your skin is absorbing. We use alcohol as a vehicle to give you medicine. Why? Because you absorb it.
Right.
It allows you to absorb things better. The alcohol, the ego is inside.
I'm asking this question for someone who's trying to make up excuses and say, oh, doc, but I didn't drink the alcohol. I just, you know, and sometimes...
Get the non-alcoholic beer.
There's
It's
this
available.
interesting thing I heard when a lady said, oh, just a shot of whiskey on the child's head, you know, it will kill the worms. And,
Worms.
you know, yeah, and all these myths
She has got
around-
worms in her uterus.
I don't even
In
know
her
where,
uterus,
where
worms.
they hear all these things from.
And then she's very ill. She needs surgery to take out the worms.
Just a shot of whiskey.
No.
They say it won't harm the child.
No, please, we don't want. And the problems with these things, drugs, alcohol, you don't know the amount that you will take that would cause a lifelong problem for you with that child. You just abstain. I have a patient, a man. I said, oh, your wife, her system looks good now. I want to give her medication. Let's try for pregnancy this month. He said, no. Why? I've been smoking and drinking. I want 3 months clear from now. I will not smoke, I will not drink, so that all those chemicals will leave my system, so that the sperm will not have any of those in it before he makes his wife pregnant.
Doc, I'm happy you brought in the male perspective as well, because all this while we've been talking about what a woman may be doing, because she's the one incubating, she's the one carrying, and so the burden is on her. But I'm just surprised to know that it's as important for the man as well to avoid some of these things, especially
if he's trying to make her pregnant. Yes. Right. Yes, it is better if he abstains from. Different things have different effects. Alcohol, weed. Those who smoke weed, it has effects on the sperm. Cigarette smoking generally affects cilia and motility all over the body. So it doesn't mean that you cannot make a woman pregnant if you smoke. It just means that you are reducing your chances. And if she's having difficulty in getting pregnant, it is better if you don't do those things. The woman's, apart from producing the gene, has to carry the baby for 9 months. So during the period that she's carrying the baby for 9 months, all the things she indulges in also affects the baby. You know, they always give you restrictions about drugs when you're pregnant, because you take the drug, it enters your bloodstream, some is filtered to the baby. So the drug you take is filtered to the baby. It has been found in the baby's blood afterwards. And therefore, it may impact the baby. So we say, oh, don't take this medication at this time because it can affect your baby. So the things you do can actually affect your baby.
So, Doc, let me take you back to the question about women with chronic diseases, because then there are some of them who are constantly on medication, managing their symptoms and all that. How do they go about it if they want to get pregnant or even in the process of pregnancy?
So if you have a chronic disease and you intend to get pregnant, you should have a discussion with your chronic disease doctor that, hey, I'm going to be trying to get pregnant over the next few months. Will any of my medications impact my baby? The doctor will then look at your medications, and if there are any of them that will impact your baby, he will give you an alternative. Now, the objective of the alternative is that this is milder, and your baby can cope with that a whole lot better, compared to the other one where he was giving you before, that if he gave it to you, may indeed affect the way your baby functions or the baby grows. So he can do that. Then if you do get pregnant, you inform your obstetrician that these are the medications my doctor has put me on for my chronic condition.
Right.
Then he also starts from his end. If there's any medication he doesn't like, then he has a discussion direct to your doctor or tells your doctor, hey, can you change this to this other one because this other one doesn't cross the placenta. The objective is, I wouldn't want to be changing what your other doctor is giving you, but we need to collaborate and agree as to what is best for our clients. And that is what the thing is. You get the right kind of medication that will manage your chronic condition, but will not adversely affect your baby. And we do that for thyroid disease, we do that for diabetes, all different conditions. Okay, they all have medications that we can give.
Doc, since, I mean, a lot of women don't plan pregnancies, even for people who are married and are hoping to build families, sometimes they tell you, I wasn't expecting it. Why don't we just put these women on these medications that you've suggested? Why do we need to wait? Because some people may catch it late, and who knows, it may affect the child and all that.
Now, what are the doctor seeing a patient who is non-pregnant is looking for the best treatment, and of all the options may choose what is best for you at that time. It may achieve good results, and everybody's happy about it. The challenge comes with when she says she wants to get pregnant. Then we have to change the medication to another one, which may not give us as excellent results as the first one did, but we are being considerate of the pregnancy which is coming. You must also remember that the pregnancy itself changes your body. So the way your body even responds to the first drug might not be the same as the way it used to respond when you're non-pregnant. All the drugs that we have were tested on non-pregnant people, because you can't test drugs on pregnant people. Okay. So the treatment, the calculations, everything, there's one particular drug that we give for hypertension, and my argument is that it's supposed to last for this number of hours, and I say it lasts for a shorter number of hours because in pregnant women, they metabolize it faster. Okay. So if you change the way you give it, instead of the standard way, you get a better cover compared to if you did it the way they say you should do it. And these are differences that occur just because the woman is pregnant. So if she's not pregnant, you want to give her what you think is best for her. The moment she says she intends to get pregnant or she wants to get pregnant, we will have to change it to some other drug. So that is why the moment you get pregnant, please inform your doctor that I've missed my period.
There's a lot to explore. We'll be talking about environmental factors and how they affect the child's emotional development. We'll also be talking about medical interventions that help you cater for your children in the womb, just in case the doctors detect an anomaly. Do stay with us. We'll be right back. Thank you so much for staying on The Baby Doctor with me, Bernice Abu Beidulansa. Here we are all about making children happier and healthier, because guess what? A happy child makes a happy home. Today we've been talking about caring for your child once they are in the womb, and Dr. Paddy Ayete of Elemas Health has been helping us with all the information we need so far on all the topics that we've touched on. It's now time to talk about the environment that a child is growing in, even though they're in the mother's womb. So, i.e., the mother's environment. We've already established the importance of what a mother eats, medications and all that, because of the impact they may have on baby. But what about the environment a woman finds herself in? Does her mood affect the child and the child's emotional development, whether she's happy, whether she's sad, whether she's been abused, etc.?
The mother's environment affects the way she feels. And the way she feels affects the way the child feels. So if the mother is stressed, stress hormones are going to go up. Those stress hormones will go into the baby, and the baby's stress levels too are going to go up. If a mother's, it's always interesting to see, sometimes you listen to the baby's heartbeat, and it's very fast. Then you check the mother's heartbeat, and hers too is fast. Then you understand, the baby's heartbeat is fast because the mother's heartbeat is fast. And that's heartbeats. I mean, your heart and your heart, but look at the way it is. We would prefer that our pregnant mothers are in the least stressful environment, as possible. And we encourage spouses to be as supportive as possible. There's a story I tell my clients, which is the woman who is pregnant is not your wife. She has been possessed by an alien, and that alien determines all the things that she does. And everything that she does to you, she doesn't remember. Everything you do to her, she will go and tell your wife when your wife comes back that this is what you did. And your wife will hold it against you for the rest of your life. So just cope.
Right.
Do your best for the, crazy requests that may come, and this too shall pass. Thankfully, it's a self-limited, sexually transmitted disease. It will end. And the husbands that are able to make that adjustment, to know that, something, this is just for a season, it's not her fault, it's the baby that is making things like that, and have become tolerant and understanding, are able to cope better. But it allows them to create an environment that allows the pregnant woman to thrive and not to be as stressed. Stress, once she gets stressed, other things go wrong. And those other things that go wrong can eventually result in an adverse outcome. The baby feels the stress. The pregnancy itself may not be able to continue because as a result of the stress that is this. And there are several, and that is only one part of it. We don't want the pregnant woman to be in a room where people are smoking because she will inhale the nicotine and she will inhale the cancer-causing chemicals in cigarettes. It will affect her. Therefore, it will affect the baby. We don't want her to be in an environment where there are high chemicals that you can absorb either onto her skin or inhale or get inside her. All those things are from the environment. So environmental toxins are a problem. Environmental situations that are around her, as in stressful situations, emotional situations, can also give her challenges, and those challenges transmit to the baby. And babies, even though they are in utero, are pretty perceptive of the environment that is around them. It has been found that when a husband comes home, the baby is aware. The baby in the tummy is aware. And the husband can come home and speak to that baby, and the baby would respond by action. No, the baby wouldn't say, hello, daddy, but he will respond by action. And you know that, hey, he is responding to your voice. It's been said that if you want your child to become a very good mathematician, play Mozart to that child. That means this country, I don't know how many mathematicians will produce, because how many of us are playing Mozart to our children? But there are things that, music that is outside the womb, basically outside the mother's body, the baby inside the womb. And think about it: skin, subcutaneous tissue, muscle, sheath, peritoneum, uterine wall, uterine muscle, endometrium into the sac, inside a bag of water, and the baby can still hear that sound or perceive that sound. It shows how aware the baby is of the external environment inside the mother, external to the baby, so therefore inside the mother, and even the environment the mother is in as well. And if you want to have good outcomes, try and create a good environment, all around.
And talking about the child responding to the father's voice or knowing the father's voice, it reminds me of my own experience. There was a certain program I was watching so much, and you won't believe it, I was shocked. When I had my first son, the program was on and he quickly turned and was looking at the TV. And I said, you remember, does it ring a bell? And then I started reading and researching more about these things and the importance of the environment and how even the child develops intellectually. And the Mozart thing you've mentioned, I mean, there's some who dispute that, but generally it is established that it is important. But topical creams. Quite recently, I saw a research paper on that, on especially bleaching creams used by pregnant women. Do you just want to touch briefly on that?
Why should a pregnant woman bleach?
No, they do.
Why? What's the objective?
Because it's something they've started, and so they need to continue the
to
process. Maintenance.
Okay, sorry. Well, the skin is the largest surface that we have to absorb things. Well, the intestine too is there. Right? So anything you put on the skin can be absorbed. And it's absorbed into the bloodstream, all over the body, including into your baby. So and take note, a baby is growing. Its organs are being formed. The formation of these organs can be interrupted by chemicals. So the baby is forming nicely. The leg is forming nicely. Then you apply something on your body that contains a chemical that gives short legs. Then the leg is no longer formed properly, and your baby has an abnormality of the leg, and the leg is short. Then the baby is born, then you get up and say, this has never happened in your family, and you are from a royal home, and you can't take this baby home. But it's not your genetics. It's the things you put on your skin. It's the things you put in your body that has resulted in a baby being like that. So, essentially, when you are pregnant, you want to ensure that your body is as holy as possible. Don't put anything on your body that you are not sure is safe for your baby. It's a sacrifice for a short period. 9 months of sacrifice and 70 years of enjoyment. Or refuse to make that 9 months of sacrifice, and you may end up having 70 years of misery. Looking after a problem that you caused by your action. Only because you couldn't just manage that. You manage the Coca-Cola legs and Fanta face for a few months. You'll be fine.
So a lot of women get the pigmentation problem, especially on their faces when they begin to look dark. And some women just don't like the look of that.
So will they cut off their fat nose too? The nose is fat. What are they doing about it? They will cut it off. They will trim the nose. It will go away.
Interesting, Doc. There are many myths surrounding pregnancies and what women must do, what they must avoid. The locally made stuff that sometimes women are given. Traditionally, you're told that, this one, it will strengthen the child, or it will purify the blood, or, many of these stories that we hear. What general advice would you give in terms of locally manufactured things? And sometimes, they're given to you by mothers, grandmothers, in-laws. It can be quite difficult.
Yes. So we have a concern about the herbal products. Let's just put it that way. And the concern is not the efficacy, even though some of them have not proven efficacy, but because of the fact that they are not purified and refined. In that mixture of herbs are things that may actually cause you to have kidney failure or put your baby's life at risk. And our concern, therefore, is that if it is not something that we know is proven to be safe in pregnancy, we do not recommend that you take it because the risk is too high. If anything goes wrong, it's 100% to you. all that 1 in 10, 1 in 20, it is 100% to you. And so it's not worth it. It's not worth taking that risk for a benefit that is doubtful. So that is one. Two, you really need to ask, what exactly is this going to do and how does it do it? Because you may discover that what they are asking you to take it for actually is not necessary. Like the whiskey on the head thing. The whiskey does not reach the head, so there's no point. There are so many things that they say that you really need to just ask a few questions. But I tell people that my general recommendation is not to say no. You can collect it and dispose of it accordingly. Because that whole friction that comes up, and I gave her this and she won't take it and blah, blah, blah. If it's an amulet, maybe it shouldn't enter your house. But if it is a drink or something, you can receive it. And when you reach home, you would deal with it accordingly. But it's sometimes not the wisest thing to tell them, I won't take it, I won't do this. It brings unnecessary strife. Let them be happy that they've thought of you. For a lot of them, they are speaking from a good place. This is what was used in their pregnancy that gave birth to them. This is what they have used for they themselves. So for some of them, it is because we've used this. We believe it made a difference in our life. We want to share that with you. And who knows, they may be right. The issue may be because it is not proven or tested. There are so many things that we would love. I'm sure there are solutions that we have in our herbal products. But bring it, test it, prove it, and then let it be distributed to the market knowing that, hey, it has a proven efficacy. They are trying to hide it from themselves and from their own children so that they die with it. And the result is that...
Special recipe.
It doesn't go anywhere. KFC special recipe is all over,
it's all over the
world.
place now.
We are all doing it. Coca-Cola special recipe is all over the place. Atamin's special recipe died with him.
Well, it's a really important subject that we have to touch on, especially on the issue of traditional or herbal concoctions that a lot of women have to or given to take during pregnancy. But finally, before we wrap up, Doc, there is the advancement of science, there is technology that is available to women, even if the child, for example, if you detect an anomaly, and I know there are hospitals around the country now that provide anomaly scans, which is not something you get everywhere though, but what can be done? What are the medical interventions that we can give to baby in utero once we determine that baby is not well?
Okay. So, yes, those interventions do exist. I'll give you one example. So I had a patient who had a blood incompatibility problem. That is, the mother's blood group and the baby's blood group were not compatible. And as a result of that, the baby became very jaundiced and the baby died. So the next time she got pregnant, I gave her certain warnings that the next time you get pregnant, we will check your blood. And if we think titers are rising, knowing your husband's blood group already, we know that problem will occur. And at a certain point in time, we will need to change the baby's blood in your uterus. And now this is something that we couldn't do, but we found here a hospital in the UK that could do it. So she went to the UK, and with my long essay, telling them this was the problem, this is a test we did, and we strongly believe that this will happen in this pregnancy, and so we are suggesting that they do X, Y, Z. They read it and said it wasn't going to happen. A few weeks later, they tested her and realized it was happening. So they did an ultrasound, and under ultrasound guidance, put a needle through her tummy wall, through her uterine wall, through the sac, to the baby's umbilical artery, and changed the baby's blood. Wow. In utero. This was in the UK. And they did it for her. Babies survived. Interventions like that exist. Recently, there's a gentleman, I think it's Nigerian actually, but it's in America, who did in utero surgery. So cut the tummy, cut the uterus, butter the sac, baby, did the surgery on the baby for, I think it was a heart problem or a chest problem, and then put the baby back inside the uterus and the mother continued to carry the pregnancy and delivered later on. These are high technology things. The challenge has always been in our part of the world is we don't have the equipment to do some of these things, and the cost of the equipment and the cost of replacing the equipment, because unfortunately with our healthcare system and replacement, it's always a bit of a challenge, and pricing and replacement. But those interventions do exist, especially in advanced countries, to do things for the baby in utero. But some of the things that, I mean, the nice thing about detecting some of these problems here is that you can see this child has this problem, and then you can start talking with the doctor who can operate on that problem even before the baby is born.
Okay.
And we had one case like that where we detected the problem. The intestines were not connected to each other. And we detected it by ultrasound in utero. Discussed with the pediatric surgeon that the baby has this problem. This is what needs done. And we agreed. The pediatric surgery said we can do the surgery for the baby on a Tuesday. We spoke to the radiologist who agreed to do the tests for the baby on a Tuesday morning. And then we delivered the baby Tuesday dawn. Took the baby's blood sample, sent straight to radiology. Radiology ran their tests, printed out their results, sent to pediatric surgery. The blood sample that we took at 5 a.m. got to pediatric surgery by the time the baby got to pediatric surgery. So the baby was there, radiology results were there, lab results were there, straight to theater, same day. So those interventions are possible if you can plan those things ahead. And that comes by detecting those kinds of problems early, that this is the problem coming, let's plan for it. And it is possible to do that in this country.
Well, I hope you've learned a lot today. Dr. Paddy Ayete helping us with all the information we need about in utero care, the very vital and important ones. And before we go, here are tidbits for today.
Prenatal care. Avoid self-medication. Avoid smoking and alcohol consumption. Avoid activities that causes stress. Ensure to be in a safe environment. Continuous intake of your prescribed medication. Having a healthy pregnancy is one of the best ways to promote having a healthy baby.
That'll be it for today's edition of The Baby Doctor with me, Bernice Abubedu-Lansa. Let me say a very big thank you to Dr. Paddy Ayete of Elimas Health. You can find him at Airport Residential Area, number 10A Volta Street, or you can just give him a call, and the number to call is 02480755680, 02480755680. And let me also say a very big thank you to Azelle Vogue for my beautiful dress. You can find her on Instagram, Azelle Vogue, and you can call the number on your screen, and she will give you beautiful designs for all occasions. Let me say thank you again to Think Media, where we are bringing you the show from. Think Media is the best creative agency here in Ghana. Anything creative, your shows, your recordings, just allow Think Media to do the thinking for you. Until we meet again next week, it's goodbye from me. Hopefully, when we are back next week, we will be delving into delivery. Now you have taken care of baby, it's time to deliver. What must you know? I'll be back to tell you all that. Until then, it's goodbye.